Hi, Stacy here with Limelight AZ. So I want to share with you my knee is like super, well, both knees are swollen, but my left knee is like super swollen. I can barely bend it, and it hurts a lot. Um, so I'm barely able to flip over in bed at this point. Most of my weight is now going onto my right knee when doing so, um, and it's making me nervous. Well, um, I had asked recently in the bee venom groups if it would be okay to sting a knee, to try to like deal with some of the pain and inflammation and stuff earlier, because the protocol calls for doing that 3 months after you've been at 10 stings. 10 stings is your goal, is like your baseline where you want to be, and that you have to be stinging for 3 months prior to attempting to sting joints or other areas. So I had posted asking if it's ever okay because I'm having so much trouble with my knees, and found out that by stinging the knees, it will cause, or by stinging your joints too early, it'll cause massive swelling and pain, and has been known to deteriorate. I don't think that's the right word that I'm looking for, but has caused people to actually stop bee venom therapy because of how their bodies responded. So obviously I don't want to do that. But I thought it was interesting, and my knee has just been swelling more and more. My right knee is not really that swollen, although it hurts. But my left knee, man, it is just, I swear every day it's just swelling more. I'm pretty sure it's fluid that is in there because of Passionate Healers had commented on my Weird Knees post, and Jessica said that she had a knee that was like that, and it was just full of fluid and stuff. So I'm pretty sure that the fluid is getting caught up and trapped in there, making it a pain in my knee. So I am going to attempt to take some lymphatic tincture. I don't think that it's obviously, my knee isn't necessarily hooked up directly to my lymphatic system, but I'm hoping that if my lymphatic system has a little bit of a boost, maybe it'll drain a little bit of that fluid and make it a little bit easier on me. But I started kind of thinking about why it's swelling so bad, because I'm in bed, so it's not really it's not from overuse or anything like that. And somebody did say that maybe it's underuse. I suppose it's possible. But it occurred to me, I've been steadily climbing in my stinging. So since I started at 5 weeks, or not 5 weeks, at 5 stings, I've steadily climbed 1 sting each week, and haven't had any hiccups with trying to continue to the next sting level. And so tomorrow night I'm going to be hitting 10 stings. Yay! That was my first goal within bee venom therapy. So I am thinking it has something to do with that. That I have enough bee venom coming into my system now that my body is responding with swelling. And so maybe that because it's such a problem area, that it is just swelling up. I do know that I had an injury to that knee. Gosh, it's been a long time. See, my husband and I have been married 15 years, 17, so 19 years ago. I was riding my bike home from work one night, and I'm not sure what happened. I can't remember. But basically, I went flying off my bike and came crashing down on my left knee. And it hurt for a couple of years afterward. My brother got married 2 years after that, and I was able to walk and stuff just fine on the knee at that point. But when we did pictures, I had to get on that knee, and it was very painful at that point. In recent history, that's not been the case. Like, I don't have issues getting on my knees or anything. Up until Lyme, that is. So I'm thinking that part of what's going on with this knee is actually like residual effects, probably dealing with scar tissue and stuff from having hurt my knee. So I know that Lyme likes to lay in areas that are already damaged, so it makes sense. And then with the bee venom at such a high dose at this point, then that also makes sense. So we'll see if over the next few weeks if the swelling starts coming down. That's my hope, because I don't really like not being able to flip myself in bed. I'm like starting to think of ways that family members can help me get flipped, because I can't lay on one side for hours upon hours upon hours if I'm awake. I mean, it's one thing to do it 3 hours or so when you're sleeping, but even then, when I wake up, I'm like, stretching my body to try to get it unstiffened. So that kind of stinks that my knee is giving me so much trouble. But at the same time, I'm really glad I found out not to sting, because if I were to sting it, it would swell worse and hurt worse. So just have to wait it out. But I think that's about it. Just my knee. Have a good day.